Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to make cardiac bed. Remember, in nursing, whenever we want to nurse a patient, there are certain beds that is being suitable for that particular condition. So for instance, now if you want to nurse a patient that is having CCF or respiratory problems like asthma, right? So you have to nurse this patient in a cardiac position. So it is important that you make the bed to a cardiac bed so that you can nurse this patient properly. So to achieve that, sit back and watch this video to the end. Let's make a cardiac bed for our patients, and I hope today you will learn a new thing or develop on your previous knowledge, right? So sit back, watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. Thank you for your support. Thank you for your love. Thank you for all the comments. God bless you. So let's continue. To make cardiac bed, of course, you must get your requirements ready. You must set your requirements. Of course, I have 2 bed sheets, 1 blanket, 1 draw Macintosh, pillow, 1 draw sheets, pillow cases, and pillows, 2 or more. Of course, and I have backrest. If the bed doesn't have inbuilt backrest, definitely I'm going to use this backrest, and I must have also what? Bed table. All those requirements are for cardiac bed, right? So, and to make bed in nursing, you must have an assistant. So let me go and get my assistant that will help me. Of course, it's a 2 nursing procedure. So I'll go and get an assistant, then we'll perform hand hygiene before we come and carry out, make this bed. In addition to the requirements, you can also have a top shelf. You can also have sputum mug, bell, pen and paper. I have my pen and paper for the patient to communicate with me if she cannot or he cannot talk. So I have gotten my assistant already, and we have worn our gloves, so I'm ready to continue with this procedure. And of course, the nurse that is making the bed will the requirements to her side so that she can have easy access to the requirements. So I place the bed sheet, the middle of the bed. Me and my assistant spread the sheet evenly on the bed, right? So remember, whenever you are making bed, you avoid unnecessary movements. Make sure you and your assistant work in harmony. You have enough on your side? Yes. All right. So we first of all talking the foot end of the bed. Remember, when making beds, there is no rule that says you must start with foot end or head end of the bed, right? So remember, you have to make your envelope corner properly, and then this way. So we are done tucking in the foot end of the bed. So we go to the head end of the bed and tuck it in also neatly. So the next thing, remember, whenever you want to make bed, you must make foundation bed. And remember, foundation bed is a bed upon which all other beds are being made. So the next is for me to place Macintosh without tucking it in. Place the draw Macintosh also. Me and my assistant, we spread it evenly on the Macintosh so that we cover the Macintosh. Remember, this is very important. Do not allow your patients to lie down on bare plastic, right? So you have to cover the draw Macintosh properly with draw sheet, right? You tuck it in together with your assistant. So at this stage, we are done making the foundation bed without the pillow, right? So because it is cardiac bed, we have to place the backrest on the bed before we continue, right? So that we can arrange the bed, we can arrange the pillows on it. Remember, the requirement says that 2 or more pillows, right? So that we can place it. Place the backrest So since this bed doesn't have inbuilt backrest, so I'm using this as my backrest. So I'm going to place pillows on this backrest to support the patient. Remember, depending on the condition and the severity of the patient may be nursed in 60 degrees Fowler's position, 90 degrees Fowler's position, or 45 degrees, depending on the condition. So in this case, we are going to use 60 degrees for this patient. So I give my assistant the pillow so that we can fix the pillows. So pull. So together with my assistant, we try to place the pillows appropriately. I said 2 or more pillows, right? So in this case, I'm going to use 3 pillows for this bed. Okay, of course we need the top sheets, right? So because the patient may need to cover his or herself, right? So after which I have to place the pull to your side, right? And then place the blankets also and spread it together with your assistant evenly. So this can be done is either ways. This can be done before placing the pillows, and it can also be done after placing the pillows, right? Since it's cardiac bed. So together with my assistant, we tuck in the top sheets. Yeah, and then also remember this bed sheet is the length is not the same thing with the blankets. So we have to place it this way. So as you're making your bed, make sure that there are no wrinkles on your bed so that it will help the patient not to develop pressure sores. So after placing the top sheets, of course, this way then we bring the bed table and place the bell, the sputum mug, then pen and paper, of course, for communicating if the patient cannot talk, maybe due to the severity of the case of the patient. So the patient can easily communicate. Had it been there is a bell by the wall for the patients to press, there is no need of me pressing this bell. But of course, I have to improvise with this bell, right? And the patient can sputum inside the sputum mug so that the patient don't have to like going in and out of the bed just to be spitting sputum outside. So the next thing now is for me to doff my glove. Of course, after every procedure you have to doff your glove and perform hand hygiene, right? So you have to be very careful while removing your glove so that you not contaminate yourself. You have to do something like this and then put in your index finger and then pull and drop it inside a bin, right? Discard it. So thank you for staying with me to the end of this video. Thank you for watching and liking my videos. Thank you very much. Thank you. Do not forget to like, share and subscribe to my YouTube channel. Thank you very much. Bye bye.